Alright, I'm going to go ahead and verify my physician's order, see that we need to do a trach cleaning. I gather my supplies. I would go into my patient's room, introduce myself, make sure that I have the right patient by checking their name and date of birth. I would do hand hygiene, apply clean gloves. I would ask the patient to do 5 to 6 deep breaths for me to hyperoxygenate. And then after that, I would set the oxygen close by. At this point, I would go ahead and take off this old dressing since I have clean gloves on. And then I would go ahead and put on my PPE. I'd take these gloves off, perform hand hygiene, and then I would go ahead and don my gown and my face shield and a mask before setting up my sterile field.
Almost got it.
All right. Okay, now at this point, I'm going to perform hand hygiene, put clean gloves on, set up my sterile field, take this out and do a make sure I don't touch more than a 1 inch border, and put my shiny side down. I take out my sterile gloves, set them to the side, and then take this and pour onto my sterile field. Okay, now I would go ahead, and these are new bottles. The expiration date is good. If they weren't new bottles, I would lift them and then pour into my tray, and also do the same thing with the peroxide and pour. And then at this point, I still have clean gloves on. Go ahead and take out the inner cannula and drop it into my peroxide. And then I would take my gloves off, do hand hygiene, and I'd put on my sterile gloves. Alright, now that I'm sterile, I'm going to go ahead and pick up my cannula and take my pipe cleaner and clean the inside. Make sure to get all the crusties off, even on the outside. After that, I would drop it into the saline and let that rinse off. This would be my trash at this point. And then at this point, I'd take it out of the saline and take my pipe cleaners and clean the inside of my thing. And then dry the outside out as well. Put the cannula back in. At this point, I can take my Q-tips and clean the outside. And clean the outside of the tray on this side. I'm going to take a new dressing and put the new dressing on. And then I would also have a tie that I would go ahead and put around the patient's neck. Make sure I don't take off the old tie until I have the new tie on. Make sure that that's in place and then remove the old tie. And then I would put the oxygen back on. And then at this point, make sure everything looks good, make sure the patient's okay. I would take my gloves off, perform hand hygiene, clean up my mess, document how the patient tolerated any secretions or any discoloration around the trays.